It's 6 in the morning, you just woke up, and before you even put your feet on the floor, you already feel it. That familiar burning sensation running down your leg. You take a deep breath, slowly get out of bed, go to the floor, and start doing your stretches. The same ones as always, the ones your doctor recommended, the ones you found on YouTube. You do everything exactly right. And when you finish, the pain is still there, or it's worse. If that's you, I need you to listen very carefully to what I'm about to say. Those stretches may be feeding the exact pain you're trying to cure. It's not weakness, it's not lack of effort. There is a fundamental anatomical difference between your spine today and the spine of the person who designed those exercises. And that difference changes everything. My name is Dr. Grace Prescott. I specialize in spinal medicine with a focus on patients over 60. I've treated hundreds of cases just like yours. And in the next 12 minutes, I'm going to explain what's happening, why it's happening, and what actually works. Stay until the end, because I'm going to reveal 3 mistakes you're probably making every single day that are throwing away every bit of progress you make. One of those mistakes kept one of my patients trapped in pain for 8 months. 8 months doing everything right. Let me tell you about Rose. 68 years old, retired school teacher, grandmother of 4. She came into my office in a borrowed wheelchair, not because she couldn't walk, she could, but because walking more than 10 minutes left her right leg so numb that she was afraid of falling. 8 months earlier, she had started physical therapy. She walked 40 minutes every day. She took anti-inflammatories. She did the extension stretches everyone recommends. She followed every instruction to the letter, and she got worse every single week. When I looked at her spine, I understood the problem in 30 seconds. She was doing exactly what you do for a young herniated disc, except her problem wasn't a herniation, it was stenosis. And for stenosis, those exercises are poison. 3 weeks after changing her approach, she walked back into my office. No wheelchair, no cane. She cried. I almost cried too. What changed? One simple thing, but I need you to understand the mechanics behind it, because without understanding it, you'll keep pushing the door from the wrong side. Picture your spine as a stack of bones with small windows between them. Through those windows run your nerves, including the sciatic nerve, which travels down your leg. When you're young and have a herniated disc, the disc pushes backward and compresses the nerve. The conventional solution makes sense. Arch your back to push the disc forward. The windows stay open, the nerve can breathe. But what happens over time? Our discs lose height, like a sponge that's been squeezed for decades. The canal narrows. The windows get smaller. This has a name, spinal stenosis, and it can be made worse by arthritis. Now here's the part nobody explains properly. When you have stenosis and try to stand up perfectly straight or do those extension stretches, you close those windows even further. The nerve gets pinched, the pain increases, and you think it's because you're not trying hard enough. That's what Rose thought. 8 months squeezing her own nerve, thinking she was healing. The solution, the opposite of what you were taught, gentle flexion, rounding the spine forward, that opens the windows. It gives the nerve space. The pressure drops. Simple as that. Now let's practice. 3 exercises, all based on this principle, all safe for arthritis and stenosis. The first exercise is perfect to do first thing in the morning when your back feels stiff as a board, or right before bed. You can do it on your own mattress without getting off the bed. Step 1, lie on your back, knees bent, feet flat. Take a deep breath. Let your back rest against the mattress without forcing anything. Step 2, bring your right knee toward your chest. If you have knee discomfort, don't grab the top of the kneecap. Place your hands behind your thigh instead. Go only as far as feels comfortable. You should feel a gentle stretch in your lower back and glute. Hold for 5 seconds while breathing. Slowly release. Step 3, repeat on the left side. One side usually feels tighter. That's completely normal. Don't force it to match the other side. Step 4, the double hug. Now bring both knees together toward your chest. This position fully flattens the lumbar curve. The windows open as wide as they can. If you'd like, gently rock side to side. Do the full sequence 10 times. Rose started with this exercise. On the very first morning, she told me it was the first time in months she'd been able to get out of bed without grabbing the headboard. Important? During the movement, the sensation should be relief or neutral. Pain that increases or shoots down your leg, stop immediately. The second exercise is about lubrication. Think of your legs as windshield wipers on a car. This movement lubricates the joints locked up by arthritis and pumps fluid back into your dried out discs. Step 1. Still lying on your back, knees bent, feet shoulder width apart. Open your arms out to the sides in a T. These are your anchors. Keep your shoulders flat against the bed. Step 2. Slowly let both knees drop together to the left side. Don't force it. Let gravity take them to a natural stopping point. Feel the stretch in your right hip. Hold for 1 second. Step 3. Use your core to bring your knees back to center, then let them drop to the right side. Keep your left shoulder pressed against the bed. That resistance creates the gentle twist in your lower spine. Your windows are being massaged. Repeat this pendulum. Left, center, right, center. 15 to 20 times. Slow, almost hypnotic rhythm, like rocking a baby to sleep. The third exercise is the most powerful for immediate decompression. Perfect for those who have trouble getting down to the floor or as emergency relief during the day. All you need is a sturdy chair. Step 1. Sit on the edge of the chair, feet flat on the floor. Spread your knees well beyond hip width. That space is essential for your torso to dive forward. Step 2. Hands on your thighs, chin drops toward your chest, shoulders round forward, hands slide down your legs toward your ankles. Let your head hang heavy. Go only as far as your body naturally stops. Step 3. Close your eyes. 3 deep breaths, imagining the air going straight to your lower back. With each exhale, sink just a little bit more. Gravity is gently opening your windows. Step 4. Never come up all at once. Use your hands on your legs as a guide rail. Stack your spine from the bottom up, lower back, mid-back, shoulders, then head. Pause before you move. Repeat 5 times. Use this exercise whenever you feel heaviness or numbness in your legs. It's a lifesaver for spinal stenosis. If you did those exercises along with me just now, you may already be feeling that first sense of lightness, the signal that your windows are starting to open. If this video is making a difference for you, click the like button right now. That simple act helps YouTube bring this content to other people going through exactly what Rose went through. Thank you. Now, the 3 hidden mistakes. One of them is probably the reason you still haven't gotten better. Mistake number 1, the soldier posture. We were raised hearing, stand up straight, don't slouch. It sounds like discipline, it sounds like health, but for someone with stenosis, walking with your spine forced into extension closes your windows with every step. The slight forward lean your body naturally adopts during pain is not weakness, it's protection. Don't fight it. That was Rose's mistake 1. She walked tall out of pride and compressed her nerve with every single step. Mistake number 2, the heroic walk. Walking is essential, but pushing through after your leg goes numb is burning your nerve little by little. The rule is simple. Feel the first sign of discomfort. Sit down. Do the diver exercise. Rest for 1 minute, then resume. Walking with breaks heals. Walking through gritted teeth causes real damage. Mistake number 3, sleeping without support. If you sleep on your back with your legs straight, your lower back arches all night. Windows closed for 8 hours straight. Solution, a pillow under your knees. If you sleep on your side, your top leg slides forward and twists your pelvis like a wet towel being wrung out. Solution, a pillow between your knees. Simple and non-negotiable. It turns the entire night into recovery instead of damage. These exercises work. Rose is proof of that. And so are hundreds of other patients I've treated over the years. But I need to be honest with you about something. The exercises open the windows. They take the mechanical pressure off the nerve. But a nerve that's been compressed for months or years still carries internal inflammation, an irritation that lingers even on the days you don't feel pain. And if that inflammation isn't addressed, it makes your nerve react much more intensely to anything. A longer walk, a bad night's sleep, a stressful day. That's what happened with Rose. 3 weeks doing the exercises and she was already walking without a cane. But she still had that residual numbness in her leg, especially at night. That's when I introduced an additional support, completely natural, no medication, no side effects, that works directly on the inflammation in the nerve tissue from the inside. In 2 weeks, the numbness was gone. Since then, I've been recommending this same support to patients with chronic sciatica, stenosis, and neuropathy. The results have been consistent, especially in people over 60 who have tried everything and couldn't find lasting relief. It's not a miracle, it's science applied to the aging nerve, which responds differently and needs different support. If you want to speed up your recovery and support your nerve from the inside as well, I've left the link in the description and pinned in the first comment. It's the same support I use with my patients, and there's absolutely no risk to you. It comes with a 60-day guarantee. If it doesn't work for you, you get every penny back. No questions asked. You already took the first step today by doing these exercises. Don't stop halfway. One last thing before we finish. Never do these exercises during an acute pain flare-up. If at any point during a movement the pain increases or shoots down your leg, stop immediately and seek professional evaluation. And finally, something almost nobody talks about when it comes to sciatica over 60. The real enemy isn't the compressed nerve. It's the muscle that was supposed to be protecting that nerve and has gone weak. When that muscle gives out, it doesn't matter what you do. The compression comes back every time. Subscribe now so you don't miss it. Take good care of those windows.